Hi, my name is Ninive Reyes, and the disease that I chose to focus on for this project is hypoplastic left heart syndrome, and this is the website that I created. So we're going to start off with the introduction and background. Something that I chose to include here is this video by the Children's Healthcare of Atlanta. I feel like it was a really good, concise video explaining what HLHS is and specifically explaining to people who don't have prior knowledge maybe to the anatomy and function of the heart. So I feel like that was a really good supplemental video. Down here, I just have images of the before and after surgeries of a patient with HLHS, kind of foreshadowing the treatment page that we'll see later on. Here's the phenotype and symptoms page. I chose to include this image of blood flow seen in a patient with HLHS, and I chose to put it right next to the symptoms because we can kind of see why we see the symptoms. For example, cyanosis and weak pulse. We see it because the left ventricle is small and therefore causes low blood perfusion to the rest of the body. And also, we can kind of explain how tachycardia is seen kind of as a compensatory measure for this low blood perfusion. For diagnosis, I chose to include this. It was suggested to me by one of the peer reviews done on my website. It's a great image of the fetal echocardiogram, seeing what we see in a patient with HLHS, being a small left ventricle. And here we move on to the phenotype area, and I chose to include this pedigree just because I feel like it does a really good job of explaining why HLHS is a complex trait and why it shouldn't be dismissed as a simple recessive or dominant trait. So now we're going to move on to the tissues affected. This might be one of my favorite pages just because of this interactive, image carousel that I added here. I feel like it really brings focus to the areas of the heart that we need to that we see affected in HLHS, such as here. We start off with the absence of mitral valve, a small left ventricle, and a hypoplastic aorta. We're going to move on to the genes affected. And here I listed off the genes affected, Notch1, NKX2 through 5, HAND1, and FOXC2/L1. I incorporated images for almost all of these genes. It was really difficult finding images for FOXC2L1. But here I kind of included images that were seen in research articles, seeing how these the absence or mutation of these genes causes cardiac malformation, and this is what we see in all of these images here. We're going to move on to the treatments and therapies. This is where we'll find the most interesting part to me, which was definitely the Norwood procedure as well as the other staged palliative surgeries seen. Patients with HLHS undergo all of these surgeries during different stages of their infant life. We also see heart transplant as an option of treatment. And here, instead of choosing an image of a heart transplant, I chose to include this link, which goes to the story of a child named Hudson who had undergone all of the 3 palliative surgeries and then resulted in needing a heart transplant later on due to multiple complications. And I liked including this just because I feel like it gave us the patient's point of view and a story other than focusing on genetics. Although it is very interesting, we kind of get to see a more personal point of view right here. Now we're going to move on to the last section, which is current research. And my 2 favorite have to be stem cell therapy and the Notch1 and nitric oxide research papers, just because, I focused my paper summary on this, and I really liked how we saw how Notch1 is a nitric oxide dependent signaling pathway, and maybe we can use that later on as a treatment option for patients with HLHS, as well as using stem cell therapy to treat HLHS in the future. And so that is my website. I truly enjoyed doing this project, and I hope you learned a lot from this, as well as other people who might use this in the future, just bringing awareness and knowledge to people about HLHS. So thank you.